Bulimia nervosa. This disorder is generally marked by binge eating, consuming a large amount of food in a short amount of time, which is a result of trying to avoid weight gain by any means possible. This can also be marked by excessive fasting or exercising.
Someone living with bulimia experiences a lack of control in their life in regards to food. They binge eat large amounts of food in a short amount of time, and then they are desperate to avoid any weight gain possible. To avoid such a thing, many people go to extreme measures by either vomiting, abusing laxatives, or excessive exercising. This becomes a repeated cycle of making sure no extra calories stay within their system that could potentially allow them to gain weight.
There are three essential features of bulimia nervosa: recurrent episodes of binge eating, recurrent inappropriate behaviors to prevent weight gain, and self-evaluation that is influenced by body shape and weight. To qualify for the diagnosis, the binge eating and inappropriate behaviors must occur on average at least once per week for 3 months.
Some typical symptoms of bulimia nervosa consists of the lack of self-control, feeling guilty or shameful in regards to eating, anxiety, and depression, binge eating, purging or vomiting, and having acid reflux or a sore throat. It also includes self-harm and also low self-esteem in regards to body image.
Different severities that people experience. The minimum level of severity based on the frequency of inappropriate compensatory behaviors. The level of severity may be increased to reflect other symptoms and the degree of functional disability. Mild would be an average of 1 to 3 episodes per week, moderate would be an average of 4 to 7 episodes per week, and severe would be an average of 8 to 13 episodes per week.
The feelings that people experience during bulimia nervosa. Sometimes they feel as though they need to be in control. People with bulimia feel as though they need to be perfect. They feel as though they are always overweight. Sometimes guilty or shameful about what they eat and look like. Sometimes they never feel good enough.
Generally, people with bulimia are filled with thoughts of worry and a desire for perfection. One person quoted, "It's a race that you're just never going to win. It's always going to end badly if you just keep going." Another person who has bulimia quoted, "It's like having somebody in your head telling you that everything you do is wrong, like you can't please it no matter what you do. If you go for a walk, you've not walked far enough. If you eat a lettuce leaf, you still should not have had it. It's like nothing you can do is good enough for it."
Treatment options for bulimia include psychotherapy sessions, nutritional counseling, the behavioral technique of exposure plus response prevention, group therapy, antidepressants.
Some of the symptoms of bulimia in partial remission are still present. However, when you're in full remission, some of the symptoms of bulimia are not present.
Bulimia nervosa is a very serious disorder. One thing to remember is that this is not just for women. It is a people's disorder. Despite all of the negative aspects of this disorder, there are still people who overcome it. Stay strong.